Why would I vote Libertarian?
Great question. Thank you for asking. I think people should vote Libertarian because it actually is something different. And what we've seen so far is, how many years of the same, and society, I think, just people getting more and more in debt, less services being available, longer wait times for everything, and just crisis after crisis in our communities. We've tried that. We've tried the big two, let's say, the liberal and conservative, many, many years in a row. This is where we are. So the libertarian philosophy of less government, more money back in people's pockets, open up society for more competition, let's say, business-wise, school-wise. Why not?
So more private than social?
Not necessarily more private than social, but ability to opt out. So, and it's interesting because I've had a lot of discussions with different libertarians, and some of them are completely believe in the healthcare system as we have it, like universal healthcare system, and then others believe in an opportunity to opt out so they can get private. Now, when I was working for somebody else as an employee, I paid a lot of money into benefits, so I had good benefits. I paid taxes, and I know part of our taxes off our paychecks goes towards healthcare. Now, if I could have taken that tax money plus what I was paying and gotten better health services, maybe I would have chosen to do so instead of waiting for extended periods for a lot of different services. Do you know what I mean?
No, I do. I understand
Yeah.
pretty clearly. My father was very into the private healthcare when he lived in the States.
Yeah.
He paid, him and my mom paid a lot of money for their insurance. But when he got sick, he couldn't afford it because the co-op payments and whatnot, the travel required to go to it, it turned out to be a dark hole for his money.
Yeah. And I've talked to other people in the States too who have had the private health care and have had great results, let's say. Thinking particularly a cousin of mine, and they had really good private health care, so they got really good treatment for cancer and for heart conditions. But then some of their friends who didn't have that, they had to sell their house, they had to sell everything to get treatments, and then they were living with their kids again. So myself personally, I just think maybe we should try less administration and more money pushing towards services, right? So it just seems like every industry right now, education, healthcare, whatever, they're all top end heavy. And anytime money goes to any of those organizations, then 50% of it is going towards administration. So 50% of the dollar goes towards the actual services or the people, right? So it isn't working. So we need to change things because we have an aging population. There's a lot more demands, I'm going to say, for healthcare, different healthcare needs. And, I remember going to my old doctor, it was like 6 weeks to get in to see them. That's ridiculous. If I've got an issue today, I could be dead by 6 weeks from now, never having seen anybody. So, yeah, I guess it's a big question.
Yeah,
I'm not going to
huge.
say I know all the answers. I'm just saying, maybe it's time we look at a different model because what we have isn't working, and it hasn't been working for many, many years. And like when I was a child, healthcare was different, right? And we've seen that removal of different services over the years slowly, whether it be, getting your eyes checked or hearing checked or whatever. Longer and longer wait times, less covered. So what do we do?
It's a huge issue. There's no black and white answer from what I could tell. I don't understand the economics of being able to provide socialized universal health care and allow people to opt out and not pay into it because it's a collective thing. I'm pretty clear that I know there's been a lot of studies on the net cost in different countries that have privatized healthcare in public, and I don't know. They say America's system isn't the perfect one for sure. They pay more for less.
Yeah.
All right, and so if you have corporations that are profiteering at the top, and in any industry, those costs are going to be whatever the demand will pay for, right?
Yeah.
And I don't know. It's I feel it's a little bit safer myself, universal, and clean it up, and a little bit less waste. We've seen a lot of waste in healthcare,
Huge,
right? Like
huge.
the e-health system didn't work out, and a few other things that just
Let me
ate money.
Let me use this as an example. So I worked at Barclay House. I was a sales and marketing manager. So for a big part of my job, as an independent living environment, you had to be able, our clients had to be able to get themselves tuned from the bathroom and tuned from the dining room, right? So sometimes there were mobility issues that would prevent somebody from doing that. So one of the things that I did was advocate for the patients to get care that could be provided in-house, or like either private care or care from the hospital, like PSWs coming in, to be able to help them manage that, right? So they could come to an independent living instead of going to long-term care. Because they're two completely different environments, right? So with the hospitals, there was many times where, I'm trying to just get an answer, just when is this person coming out? Are the care services, that are going to be provided put in place for them? And there was like a disconnect sometimes where, for example, one lady was supposed to come in with all these care services, and then I hear from her family, not from the hospital, saying the hospital's short, so they can't provide any services for at least another week, but they're releasing her from the hospital today. So I'm like, well, they can't, because she can't come in here without these services in place. I had a doctor come in who worked in the hospital. Spouse was also a doctor, and a parent of theirs had some issues, and now they have to come into independent living and looking to provide, showering and mobility aid. So they come in to me and say, you know what, this system is so convoluted, like we're in the hospital system and we can't even navigate through the care providers, like through, I guess it was Lynn. They couldn't even, they're like, we're in the system and we can't navigate the system. So how are people who aren't in the system, who don't understand the processes, able to navigate it? And I'm like, exactly, right? It should not be this complicated. And they wrote to the Health Minister of Ontario. And I was grateful, and I think more people need to do that, because it's very frustrating. It's very frustrating.
Well, after covering politics and news for about 30 years, I've seen the different swings and the fragmentation that's caused by each different government's attempt at rejigging the system, and of course. It leaves it fragmented, and there's these laps as the systems try to change to meet whatever ideologies that they're trying to do. And the inconsistency in the pendulum swings is a part of the problem.
Yeah.
Part of the problem. Barclay House, private
Independent living.
Independent living.
Yeah.
How did they do overall during the pandemic?
You know what? I was just grateful that I wasn't there during the pandemic.
Yeah.
I don't agree with the lockdowns that they imposed on all the seniors. Having worked there, spoken to the seniors there, I feel like, and I shouldn't say, I did speak to two people who had their parents in Barclay House, and they were horrified. They were really horrified. They're like, why is my parent being locked up for extended periods? They would like to make that choice on what to do with their life. It is their life, right? So do they want to be isolated? No. Maybe some of them do, and if they do, that's their choice. But for a lot of them, they don't want to spend the last days of their lives locked away, unable to see the people that they love, And it's not like they can't, there wasn't testing available to see. There wasn't precautions that could have been taken. So I'm not sure exactly how. I think they did okay, let's say, on one end, like on